Hair loss, causes, medical and herbal treatments, and prevention. Hair loss is a problem that many people, especially women, face. This issue can have significant psychological and social impacts. In this clip, we will examine the causes and factors of hair loss, medical treatments, herbal and home remedies, and prevention strategies. Part 1: Causes and factors of hair loss. Genetics. One of the most important factors in hair loss is genetics. If there is a history of hair loss in your family, the likelihood that you will also experience this problem increases. This type of hair loss usually manifests as gradual thinning of the hair in various parts of the scalp and can begin at different ages. Hormonal changes. Hormonal changes can play a significant role in hair loss. Pregnancy, childbirth, menopause, and even the use of certain birth control pills can cause hormonal fluctuations that lead to hair loss. Thyroid problems are also other hormonal factors affecting hair loss. Diseases and medical conditions. Certain diseases and medical conditions can lead to hair loss. These include autoimmune diseases such as alopecia areata, lupus, and thyroid problems. Skin infections and diseases like diabetes can also cause hair loss. Medications. Taking certain medications can cause hair loss. Blood thinners, antidepressants, blood pressure medications, and cancer treatments are examples of drugs that can lead to hair loss. Stress and lifestyle. Chronic stress and an unhealthy lifestyle are also factors influencing hair loss. Stress can disrupt the hair growth cycle, leading to sudden hair loss. Poor nutrition, vitamin and mineral deficiencies, and improper hair care can also contribute to hair loss. Part 2: Medical treatments for hair loss. Prescription medications. Doctors may prescribe various medications to treat hair loss. Two main drugs commonly used for this purpose are minoxidil, a topical solution or foam applied directly to the scalp, which can stimulate hair growth and reduce hair loss. Finasteride, this drug is usually prescribed for men, but in some cases, it may be used for women. Finasteride reduces the production of dihydrotestosterone, which is a factor in hair loss. Hormonal treatments. In cases where hair loss is due to hormonal changes, the doctor may recommend hormonal treatments such as taking birth control pills or hormone therapy. Hair transplantation. Hair transplantation is a surgical method in which hair resistant to hair loss is moved from other parts of the scalp or body to bald areas. This method can provide permanent and satisfying results. Laser therapy. Using low-intensity laser therapy can stimulate hair growth and reduce hair loss. This method is usually performed regularly over several sessions. Part 3: Herbal and home remedies for hair loss. Proper nutrition. A healthy and balanced diet plays a crucial role in hair health. Consuming foods rich in vitamins and minerals such as iron, zinc, vitamin D, and biotin can help strengthen hair growth. Foods like fish, eggs, spinach, and nuts are beneficial for this purpose. Herbal oils. Massaging the scalp with natural oils such as coconut oil, olive oil, or castor oil can improve scalp health and strengthen hair. These oils have moisturizing and nourishing properties that can stimulate hair growth. Aloe vera. Applying aloe vera gel on the scalp can reduce inflammation and help hair growth. Aloe vera has antibacterial and anti-inflammatory properties that can improve scalp health. Onion and garlic. Onion or garlic juice contains sulfur, which can stimulate hair growth. Applying onion or garlic juice on the scalp and then washing it can help reduce hair loss. Green tea. Green tea extract contains powerful antioxidants that can improve hair health and reduce hair loss. Applying green tea extract on the scalp can stimulate hair growth. Part 4: Prevention of hair loss. Proper hair care. Using shampoos and hair products suitable for your hair type and scalp can help maintain hair health. Avoid excessive brushing and frequent use of heat styling tools like blow dryers and straighteners. Stress reduction. Stress can be a significant factor in hair loss. Techniques for managing stress such as meditation, yoga, breathing exercises, and regular exercise can help reduce stress and improve overall health. Adequate sleep and regular rest also play an important role in reducing stress and maintaining hair health. Healthy diet. A diet rich in proteins, vitamins, and minerals is essential for maintaining hair health. Consuming foods like fish, eggs, spinach, nuts, and fruits can provide the necessary nutrients for hair growth and strengthening. Avoiding harsh chemicals. Frequent use of hair dyes, strong chemicals, and hair products containing harmful substances such as sulfates and parabens can damage hair and lead to hair loss. Using more natural and gentle hair products is recommended. Protecting hair from environmental factors. Protecting hair from severe sun exposure, pollution, and chlorinated water can prevent damage and hair loss. Wearing a hat or scarf when exposed to the sun and washing hair with clean water after swimming in chlorinated pools is recommended. If you enjoyed this program, don't forget to subscribe and like. If you have any questions, ask in the comments section. Thank you.